Hi everyone. In this video, I am going to repeat a few of the past things that I've repeated regarding my medical experience journey in US and in India. And I'll still focus about my health journey in India, but having worked in US healthcare in hospitals and clinics as a pharmacist in US, as a hospital administrative intern in US hospitals, I do understand a little bit more about what happens in US hospitals, having had access to US healthcare as a student in US, as a person with good health insurance in US, as a person with no health insurance in US. I went through the journey of healthcare access challenges when you have good insurance, when you don't have good insurance, when you have moderately okay insurance, when you don't have insurance at all. And in India, even though I had insurance, the problem with Indian systems of healthcare, I didn't even get to navigate the Indian insurance system. But before that, only there are so many roadblocks that a patient goes through that it is really sometimes impossible for certain patients to get the right diagnosis, and certain patients who might be in moderately ill or critically ill status end up getting a clean bill of health from the doctors simply because the doctors are unaware about understanding patient specific health factors that could be impacting the diagnostic criteria of a patient. And this is what I want to try discussing here. I don't know if I will be able to rationally discuss all elements because there's multiple elements that in my mind they are all interconnected. I have a map of everything that has actually gone on with me and what is the relevance of the map related to the personal I need to speak about when addressing these topics. But because my map is a complex map related to healthcare administration, related to medication usage, related to medication relevance in a patient's body, related to the pharmacology or toxicology of medication usage in a patient, related to diet and nutrition that impacts the patient health, related to other factors related to the patient's home environment, patient's social interactions, all of which are also important criteria and factors having and determining a patient's overall outcome, which is a big thing that needs to be discussed, which I don't know how much I'll be able to discuss in this video, but I will try to address certain issues which are a must for doctors and people who are hospital administrators, people who are training hospital personnel involved in their training, all of them, not just hospital personnel but clinic personnel, people who are involved in training people about medication usage and prescription usage, all of which needs a revamp in this century, because what is happening on earth is not sustainable based on whatever has been practiced so far on earth. And some of those practices have had some environmental and long arching health impact also, which doctors don't realize, which toxicologists and pharmacologists might realize. But the right communication dialogue needs to be created now between different groups involved in providing good healthcare. Different stakeholders of healthcare have to wake up to the places where healthcare has become challenging for the complex patients, for the poor patients, for the patients who have some limited social or socioeconomic life problems that make healthcare access a nightmare to navigate. And currently, the way healthcare systems are structured in India as well as in US, anyone who has either free insurance in India can get some access to moderate level healthcare stuff, and or at least have a false sense of security that because they have an insurance and access to doctors, government insurance and access to doctors, that they are actually going to get some quality care. And the rich in India have this assurance that if they have enough money they will be able to access quality care. But the truth on reality is quality care doesn't exist in the people I personally know who are doctors. They don't know what quality care is, even though they are highly rated doctors in India. people who I don't even know personally, and I have tried to access them as doctors to get even simple health problems resolved. Those doctors are clinically very, very bad at diagnosing patients. Some doctors in India can clinically diagnose a patient really well, like pathologists, but pathologists do not have that power of communication with the right doctor. Pathologists don't know that pathology in combination with a person who has pharmacology related education, pharmacy related education, pharmaceutical sciences related education, they all need to work together with pathologists to understand and address certain paradigms of healthcare that needs to shift and change if doctors want to really address in helping patients resolve their problems at a lower cost, at a easier level, at the beginning stages of their illnesses, rather than pushing a patient towards really bad stage or worsening statuses related to their illness. Because the more you delay someone's treatment, the more you delay the diagnostic processes related to a person's particular health condition, the more you do not understand that certain patients may not just have one disease going on with their body. A combination of diseases could be occurring in their body, all of which could be at a minor level but or moderate level, but in combination all of them synergistically can make a person really disabled or dysfunctional in health. Some of them may not have diseases just related to physical health issues, but their social, socioeconomic, other parameters of health related issues could be also impacting the primary detectable and diagnosable medical illness. But apart from the physical illness, they could have family members with social and mental illnesses who are impacting their health. They could have other financial work related challenges that could also be a contributing factor towards their recovery. All of these are necessary for medical systems, healthcare systems, medical personnel, diagnostic systems, systems related to paying out for medication, be it a government insurance or a private insurance company. Everywhere a revamp needs to happen, and also people in pharmaceutical industry also have to do a revamp. And being from the pharmaceutical industry, and I mean having studied pharma, I've only interned one time inside a pharmaceutical industry's facility. Another time as part of a group trip, we had gone to another pharmaceutical facility. We have made tablets and formulation in Indian pharmaceutical sciences coursework. So I do understand what are the steps that are involved in manufacturing of drugs. I do understand as a part of a pharmacist in US what is some of the supply chain related business practices that are involved in the pharmaceutical industry, operations related practices that goes from the pharmaceutical industries realm to the pharmacist realm in US and in other stores of India. But while I have awareness of all these aspects, if people do not have awareness about the extent of knowledge I have or the extent and depth of information of the mapping that has been done by me based on my life and work experiences, and if people themselves are unaware about why this extent of mapping is necessary for anyone to become a more functional practitioner of whatever they are doing, be they even if they are a administrator in a hospital, even if they are a pharmaceutical just a simple chemist in a local pharmacy, if they are chemists in a government place, if they are chemists in a fancy hospital of US, or a pharmacist working in the community in US. It doesn't matter where you are practicing, the profession you are practicing. Each one of us is involved in the process of healthcare delivery of some sort, and healthcare is, while healthcare is generally considered the norm realm of healthcare is considered to be about doctors, hospitals, medicines, pharmaceutical companies, real healthcare is not simply that. Real healthcare is also patient specific factors related to their home environment. So, patients' home environment conditions, patients' familial and social connection related conditions, patients' support system or lack of support system, patients' access to funds when they are going through an illness that will require a large expense, patients' other elements that have added or detracted from their overall health over the years of their life journey on earth, patients' nutritional access, and not just simply the basic nutritional thing that people have studied so far, but the impact of nutrition that is distorted when over use of chemicals have been done in our foods, and as a result of which overexposure to chemicals in raw foods to processed foods, all of which also impacts the food quality that you consume and will eventually impact the patient's health after they have consumed the food, consumed the water, the pollution parameters of the place someone lives in, the hospital someone gets treated, environmental pollution related factors. Even if a doctor is not aware about it, the people in that locality are not aware about it, the person who is suffering from the illness is not aware about it, our lack of awareness about some pollution present in our environment, some health impacting factor prevalent in our daily lifestyle choices, all of which, despite our ignorance, doesn't stop us from being impacted by it. Our ignorance only prevents us from maybe hyperventilating if there are 10 or 100 factors that are impacting our health, or grieving or hating the fact that there are so many factors that are out of our control that are impacting our health. That is all the awareness might end up doing. But that awareness is a necessary part, because without awareness, can you resolve any problems if you don't know what is the root cause of the problem? You can't effectively resolve a problem without knowing the root cause of a problem. So, if you don't have awareness, patient may or may not have that awareness, but at least the people who are providing care to the patient, providing different elements of care and caretaking to a patient, all of them definitely have to have that awareness in order to make the patient survive. But is it necessary that patient will always have the least bit awareness in comparison to if they go to a doctor or a nurse or a hospital or a clinic or a pharmacist for their medication? Is it necessary that every patient is a average less informed patient about healthcare? Or in the modern world, can patients have extra information about their own health, might have done some due diligence about their own health, either because they have worked in that field themselves and so they understand that problem that they are facing much more deeply than an average doctor they might be meeting? That could happen sometimes. They might understand something more about their medications than an average pharmacist who is dispensing that medication. And because of WebMD and many other clinically used websites like Micromedex and other things like that, patients can also search more about their medication interactions, drug interactions, drug food interactions. Their own body itself can also give them a heightened information about what is going on with them when they are going through an illness, which, when if the doctor asks them all the relevant questions, if the patient in that communication with the doctor is able to express all the relevant factors related to their health to the doctor, if the time given to the patient is enough time for the patient to discuss all the parameters associated with their health that is impacting their current health status, then only when all these parameters, all the right information is presented to the doctor, then only a doctor can give the right diagnosis. But if the doctor doesn't have the right picture, or if the doctor is only relying on objective evidence like blood pressure monitoring or pulse oximeter or some blood test, urine test, or some ECG or whatever else they are doing to figure out what is the condition the patient is going through, but the doctor is ignoring majority of the other factors. Actually, if they are only doing diagnostic criteria based diagnosis of a patient, using only the objective criteria that a machine or a blood report or something, a report that is analyzed again by some humans doing those analyzing, humans gathering the evidence, humans who might have made human error while gathering the evidence. At that point of time, there also, even though blood reports, urine reports are considered to be objective evidence, they are also sometimes subjective evidence if the person doing those analysis, drawing those samples, is not doing the sample connection in the right way as well. This is another reason, another area I would want to address. I don't know if I want to address it in this video in a in-depth level, but I may address, because if I introduce the pathological stuff, I might introduce this a little bit detailed way, because I have multiple incidences related to sample collection and the places where sample collection gets messed up, or the testing of the sample itself can get messed up and provide some false positive, false negative evidences, or mistaken perceptions of the evidence that has actually been gathered. And this is also a field of work that needs to shift and change related to sample collections, diagnostic tests, and diagnostic related processes, as well as giving patient the agency to have access to their healthcare information, which is a problem zone in India, where hospitals do not release easily the patient information unless the patient asks about it, and hospitals also do not have a good follow-up criteria in understanding. Informing the patient should be the primary goal of any hospital. In the past, I have seen, like, when my grandmother was a cancer patient, everything related to her cancer was hidden from her. She had zero clue that she had a debilitating disease. She had zero information related to her treatment protocol, treatment regimen. And being a woman, she had zero agency about whatever steps were taken to treat her. And then this being India of about 30 years back, whatever happened to her related to her treatment, for me, it is a childhood memory. So a teenager's memory. But even though it was a teenager's memory, I had found it very disturbing that she didn't have good understanding and knowledge about what was going on with her. And only person who was given the knowledge related to her health was one of her sons, who was primarily responsible in speaking to the doctors and while taking her to the doctors. And here is the problem zone, because the person who was responsible for taking care of these medication related issues, health related issues, dietary things related issues, is a person who is my father, her son, who was actually speaking. Many people don't understand this about my father, but he has some mental or social illnesses where he doesn't process information accurately. He also has some antisocial personality traits where even if he understands some situation very properly, he uses the information for, because they're antisocial, they will use something like, if the doctor says do not give the patient spicy food, being antisocial personality, he will do the opposite. He will not either inform anyone that, a person who's antisocial personality can behave antisocial in two ways. They can hide the information that is necessary to give the patient relief and supportive care and palliative care, or if they don't hide the information, they might present the right information, but they will, if they are antisocial, they can hide the medications. If they are antisocial, given to the patient for whatever other ulterior purposes they are thinking about executing on someone. And finally, if someone is antisocial personality, they could also potentially, instead of aiding someone to feel comfortable, to feel at ease, to have a supportive home environment while they are recovering from the health challenge, antisocial personality can also add to the pain of a patient, knowing what is the pain point of the patient. And when I was a child, I trusted my dad. I didn't think my dad could I didn't comprehend my dad was capable of being an antisocial personality. I didn't even know what is an antisocial personality until in the last 5 or 8 years, after I actually met a antisocial personality about whom I have written, spoken in my other spiritual earthly insights related page, where I have talked about more things related to abuse and betrayal, trauma related experiences of my life and other people's life that I can perceive is happening with them, and where heavy psychological manipulation related incidences of my past I have explained more in detail there. But in this web page also, there is one video that I had created which was related to my mother's journey of her abuse. Mostly, I believe that's what I had made that video about. It's been a while since I created that video, so it could have been about her and my journey and other health challenges. But I didn't realize this, I didn't recognize this, that my parent was an antisocial personality or had other mental or undiagnosed mental and social illnesses that are still undiagnosed, even though for 34 or 40 years I've been a witness to all the antisocial personality related, out of the norm related traits and behavioral patterns that my dad has shown repeatedly again and again and again, which is what has forced me finally to acknowledge that he's possibly an antisocial personality. When I was in my 30s, I thought maybe he is a simply a little less involved parent, a neglectful parent, and a parent who doesn't deeply care about his children. That is what was my perception when I was in my 20s and 30s, that he just didn't have deep emotional connection with anyone that I had seen him interact with, and definitely didn't have any deep emotional connections with his own children, own spouse, own siblings, anyone that I saw him interact with. But that was the early 20s version of me who felt that is all that was going wrong in my life with my parent. Then the late 20s version of me read a book, Dear John, and in Dear John, some of the narratives that were there in Dear John, where the dad in the story was categorized as Asperger or autistic, even that dad, certain behavioral patterns resonated with my dad's behavioral pattern. So I then added maybe he's potentially a little bit autistic also, so that's why he has this emotional connectivity problem. But only in the recent years, when I moved back to India and when my marriage related certain discussions were going on, twice when he came to US, he visited me in US 4 times, and in the 4 times, 2 times he visited me prior to my marriage, 2 times he visited me during my marriage related procedures. And I didn't expect him to visit me 2 times. If someone's dad, now if you have a normal dad who is emotionally connected to you and deeply loves you like a parent usually loves a child, at that time you want their parent to come and visit you again and again and again. But when you don't have that level connection with your parent, most children who have been neglected by their parents, abused by their parents, had some mental and social illnesses which drove their parents' decision making and choices in their life, those children mostly go no contact with their parents, mostly have a very fractured relationship and outside of normal relationship with their parents. But just because I was a good kid, just because I was a responsible kid, and because I didn't suspect at that time that he was an antisocial personality as well, or that he had some other ulterior motives that have been ruling my life since childhood days, I just decided that I was the first time he wanted to visit me in US, I had completely at that point of time in my late 20s, I had complete faith in my dad, so I didn't have any issue when he asked that he wants to visit in US. And then in that trip, though, I again saw patterns of abnormal behavior, which now I understand is antisocial behavior, like patterns, like, I took him to long drive related trips. Like I lived in Utah, I would travel to Colorado, Wyoming, Montana, Vegas, California. Some places I drove for 10-12 hours for some national park or some beautiful place that I took him to for sightseeing in US. Sometimes I went to cities of US where friends or family lived, so we lived with the friends and family briefly and then went sightseeing there there or did some touristy things. Sometimes I didn't even stay with any friends and family. It was just me and my dad traveling. And in all those, before I traveled with my dad, I had traveled with my ex, I had traveled with some friends. And as a child, also in social groups, I had interacted with, traveled with family or friends of my dad. And in all those settings, he was a very different person than what he was in these trips. And these trips, he was very weird, very odd behavioral patterns, no emotional interaction, no even. I even After my dad's first visit, there was also a visit that was done with a friends of my dad's whom I had known in childhood days, and they traveled with me to a few places, and they traveled partly in another trip with a friend of mine also. And with them, I could see the whole contrast of how parents or parent like figures, when traveling with children my age, will enjoy or not enjoy a trip when they are doing a touristy traveling thing. And my dad, while driving through a place where I'm feeling a little sleepy and people in the car understand that I'm the driver and I might be sleepy, they try to keep me engaged so that I wouldn't get too sleepy in the trip, or they would be mindful, like even if they had done some road map related planning also, so they were aware about road signs, traffic signs. They were a conscious participant in while I'm doing the driving, and they weren't actually doing any navigation related things by then, because I'd gone to a place where I had driven previously also by myself with some other friends, or partly driven to those places with friends. So I knew the roadmap of those places quite well. So despite that, there was still some active participation was there with them that made me feel that I'm actually traveling with someone who cares at some superficial level at least, to ensure that they understand that if I don't drive well, there could be potential accidents in the car. And so if I am feeling sleepy, they would help me with that. Or if they know that I am tired and I want to rest and stop and take breaks, they allowed me to do that. All these things, like subtle, human connection based things, where which shows that people are capable of caring for you, even though that person, those two uncle and aunties who traveled with me, I had literally, like, for 10 years, over 10 years of my life, never interacted with them. Despite that, there was a camaraderie or at least human connection present in that travel. Whereas with my dad, like, if I'm tired, he doesn't care. If I am groggy or sleepy, and this was another thing, I was extremely groggy and sleepy in some of those trips, which was very unusual. But now I feel it was very unusual, because again, I had gone to certain places which were also same repeating places as places in the past I have visited with other friends. And so when visiting with those friends, I hadn't felt groggy or sleepy, so it was suspicious why I was feeling groggy and sleepy. And I overslept in some of those trips when I went with my dad, or went with my dad and another person. And now I'm realizing that he has the potential of drugging people, being an antisocial personality, and being he himself was a cancer patient. So in his second visit, he had access to cancer related drugs or sleep related medications too, possibly all of the pain related medications, because he had surgery before his cancer as well. So he could have access to those kind of sedative, hypnotic, pain medication drugs that, if mixed with someone else's food or drinks, can make the other person also feel extremely drowsy and sleepy. He also did the same thing with my mother. I didn't realize that in the past, but at that point of time, I didn't know from where he would have got the medications at that point of a time, or whether but later on I understood that I distinctly remember when my grandmother was recovering at my uncle's place after her surgery and some radioactivity, whatever her treatment protocol was, I don't know, but she had chemotherapy, surgery, and I believe radioactivity treatment, or at least it's chemotherapy and surgery. I'm guaranteed sure she had those two treatments. So after the chemotherapy protocols were done in Mumbai, she went back to her home where her husband lives in West Bengal. And in that home, once after she had moved there, when I was visiting them, I saw her being in extreme pain. She's like, my body is aching and hurting, and because she was hurting, she had asked me to massage her and help her with her pain. And at that time, I didn't seem have any suspicion that something wrong was going on. But later, now it has taken me 30 years to correlate this, that it is highly likely that the same father who has put substances in my food potentially to cause me drowsiness, and it didn't simply happen to me in US. He has done it repeatedly in India as well. Again, I didn't know at that time because I trusted this person. So for many years, I didn't know that some drugging was possibly happening potentially, either for him, from him directly, or he just, I don't know what was going on, because I've never visibly seen him add anything, mix anything anywhere, right? So if you don't visibly see anyone, catch anyone doing this, all you can have is a suspicion about it. But why, there is a repeating pattern that people in his care who have lived individually with him for many, many years. My brother also has had phases where he's been extremely sleepy continuously for many years. I have also had these drowsiness and grogginess related phases when I've stayed with my dad. And I do not consume alcohol. I do not consume alcoholic substances. I do not consume any medications. The only one time I was prescribed some sleeping medications, I took the sleeping medication. It was giving me too much grogginess and drowsiness. I stopped consuming those medications. And most of my medications that could cause drowsiness related to sleep or depression, I also stopped consuming those medications after only brief few months of using those meds. So, or for the sleeping med, I only used it 1 week and then I stopped it. Two tablets is the max I used in the whole prescription of 30 I was given. 15 or 30 was given to me. So that was what my sleeping pills I have. That is the extent of the sleeping pills I have ever taken in my entire life. And then the anxiety pill that was given to me, again, though it was a side effect of the medication that made me so drowsy that I had to switch the medication to a pill that will not cause drowsiness. So, other than that, and then after I came back to India, slowly I was getting into a more healthier way of living where I didn't want to be dependent on medications. So slowly I had weaned off many of my medications. The need for taking medications had gone away from my life because some of the stress I had felt from abuse in certain abusive relationships in US, that stress waned away. So as soon as the abusive relationship went away, the stress of and depression related to it went away. I normalized and I didn't need antidepressants or I didn't need any medication. So I didn't used to take any medications that should cause me drowsiness. I don't consume alcohol or any other substances that should give you this drowsiness. So then the only choice is someone externally is then possibly providing you something that is causing you the drowsiness, right? And it was a repeating pattern that with every time I was with my dad, this was happening with me. And not just with me, and with me it was happening on and off because I was not consistently in his presence, right? But with my brother, I saw many years of it where he was drowsy all the time. I have seen my mother also towards the tail end of her marriage, before her death. There were many months she was like this. And this sleepiness of my mother had escalated post my grandmother's death only. And her death, before her death only, I had seen her writhing in pain. And what did I mention previously? He was the primary person who was the contact person with the medical professionals who were treating her. So he was her primary caretaker when her treatment protocol was going on with Tata Memorial in Mumbai. So at that time when Tata Memorial was treating her in Mumbai, he was the primary caretaker. So he had access to all her medications, all her medical data, and he had more access, more agency about all her medical information than she herself had. And after that also, after having this more medical agency, more access to her meds, let's say Tata Memorial, I don't know at that point of time in India what was the typical, medications people used to give, and I never looked at a single medication of my grandmother at that time. I was too young. I was in 8th standard when her cancer was treated. So when I was in 8th grade, at that time I had zero clue about ever being a pharmacist, ever going into pharmacy school. Nothing like that was there in my mind. Only as a 8th standard teenage kid, I was more interested in watching TV, hanging out with friends. And in 8th grade, I was really, really bad in studying. Also, I would only read storybooks. I was very less interested in studies. So I did really well until 7th grade. I was a okay student, or in the top at least 1/3 percentage of students of the class. In 8th standard, I was possibly in the bottom 10% or bottom 20% of the class, possibly in some subjects or some exams, because possibly my grandmother's thing had impacted my studying also. I don't know, but I was also very less interested in my studies at that time for some reason. So, being a teen, maybe hormonal change, I don't know what was going on. I can't discern what were all the factors, but many factors impacted my studying capacity during 8th standard. So, I never, had any curiosity what is the medicine my grandmother is taking. But being a pharmacist who has studied about cancer, who has studied about general cancer treatment protocols, who knows that my grandmother had esophageal cancer. Now, anyone who has had surgery or had cancer or is receiving palliative treatment after their cancer treatment was done, all of these patient categories are patients who will be given some pain medications for their cancer treatment regimen. And most of these pain medications some of them are going to be narcotic medications that will also be prescribed to the patient. Some might be simple pain medications that would be prescribed to the patient. Now, so did my dad have access to drugs that would make someone feel drowsy, extremely drowsy, medications that if given to the patient would have relieved their pain? So is there enough at least coinciding data to understand that it is possible that the drugs that should have been dispensed to my grandmother, let's say the doctor has written a prescription that 3 times a day they should be given a particular drug for their pain, and that is a prescription, normal prescription, let's say that cancer therapy or that doctor prescribes to their standard patients. So if that is the protocol the doctor is following, I don't know what is Tata Memorial's protocol about these dispensing of these medications, and what is the standard therapy 30 years back that was prevalent in India. But I do know that certain prescription drugs, general dosages could be somewhere around like this kind of a dosing. But let's say it was a 3 times a day dose that the patient was supposed to get, but instead of getting the 3 times a day dose, and that means that in a month the patient should have access to 90 tablets. And a person who is the primary caretaker has gone and got the medications now from the place where he's getting the access to her medication. He could have put my grandmother in his insurance. I don't know whether he did that. I'm assuming he might have put my grandmother under his insurance. So he might have gotten the access to her medications as well as a result of that. So let's say if he was the one responsible for now giving him 90 tablets for her month's supply for managing her pain, if someone the caretaker is an antisocial personality, this is something doctors, prescription dispensers, people working in legal systems, financial systems, healthcare related, fraud related systems, all need to get awareness about. That's why I'm talking about this incidents, and where yes, what I'm talking about is a hypothetical scenario, because I have not witnessed that person do this crime. But even if I don't witness a person doing a crime, there are other elements associated with the crime that can determine whether a crime was actually done to someone or not. Some antisocial behavior, sociopathic behavior, psychopathic behavior was executed against a certain person or a certain group of people. that can be concluded. And while for that instance direct proof is not available, in any future, if someone is like a Ted Bundy like serial offender who has continuously, if you are he did a crime where he had easy access. After having easy access, he potentially likely did this crime, where now those 90 tablets that if he had access to, instead of telling the patient that you have to take 3 tablets a day, he could have told the patient you have to only take 1 tablet a day. Will you trust someone who's your son, someone who's your family, someone who is caretaking you for your disease? You will trust that person implicitly. If that person who is also, my grandmother also didn't know Hindi language, she only knew Bengali. So obviously, if the doctor also told in front of her you have to take this 3 times a day, she doesn't understand whether she was supposed to take it 3 times a day, 2 times a day, once a day, because she doesn't understand English or Hindi. So if she doesn't understand English or Hindi, and if no one communicated to her in Bengali, or the doctor presumes that because her son is her caretaker, whatever information he is giving to the son will provide that information to the patient, right? Everyone assumes that anytime a patient is going to a doctor, the person who is presenting as that patient's primary caretaker is going to take care of the patient. But when is the person who is a primary caretaker really going to take care of a patient? When they really love a patient, when they have emotional connectivity to the patient, when they really want to relieve the pain of a patient. But if a person is an antisocial personality, has some mental illnesses, social illnesses, like psychopathy, sociopathy, narcissistic behavioral patterns, all these type of personality types have zero empathy for the person they are treating or pretending to take care of, and most of their motivations for those patients are to actually torture the patient emotionally, psychologically, financially, and also abuse a person via the drugs they provide or don't provide. So with my grandmother, this is my likely hypothesis that happened to her, that if she was supposed to have access to 90 tablets and take 3 tablets a day for her pain, or maybe it was a dosage which said take up to 3 tablets to manage your pain. But if she was only given 1 tablet a day and only 30 tablets are given, has someone with antisocial personality traits pilfered now the remaining 60 tablets, that instead of going to the patient didn't go to the patient, and the person with an antisocial personality trait or criminal mindset has pilfered the rest of the pills. And that same pills, now where did those pills disappear? Those pills went into my mother's drinks, because my mother had, because she used to do every weekend special, like in India, people understand this, fasting is done sometimes by women once a week. So my mother used to do fasting once a week, and in her fasting days she had a complete separate set of utensils that people in